Blood eosinophils are a type of white blood cell which all healthy people have circulating in the bloodstream. There are very few of them, but we all have them. When they're made in excess by the bone marrow because of some stem cell disorder, they can actually cause harm. They can deposit in all kinds of organs, especially including the inside of the heart, where it can cause fibrosis of the heart and serious heart failure. They probably occur in something like 1 in 50,000 people, or maybe even more commonly. And the reason why they're not diagnosed is because we all have eosinophils circulating, and there are definitions of how many eosinophils really begin to cause damage and for how long a duration. But in the hypereosinophilic syndromes, the high eosinophil count persists for months or years. Some of the other manifestations, hypersensitivity and allergic reactions. They get very exaggerated allergic reactions to things like insect bites. When they have an allergy to certain drugs, and they tend to be very allergic people, they can have really, really severe allergic reactions. The only treatment for these disorders has been the use of steroids, like prednisone, for example, which are very effective to ameliorate the symptoms of the disease and the signs, but they would need to be continued for long periods of time, because without them, the symptoms would come back. A brief course of prednisone or other steroids may not have significant side effects, but in the long term, it can cause diabetes, thinning of the bones, osteoporosis, central nervous system problems, and others. There are now some brand new drugs. The first one was mepolizumab, a monoclonal antibody that we were involved in doing the clinical trials, which essentially kill the eosinophils. They really target the eosinophils, and they're very, very effective with much, much less side effects.